speaker is Dr. Jhalaksreemol.
Dr. Priyanka, no?
Jhalaksreemol.
Oh, sure.
Right.
Dr.
Adult contract.
Jhalaksreemol?
She's there, sir.
Huh?
She's already there. She has come.
Okay.
So good morning all. I will be presenting a case series of adult contracted sockets treated with serial conformers. So we all know that microphthalmos is a condition where eyes are abnormally small with at least an axial length of at least 2 standard deviation below the mean for age. We can classify it again as simple and complex microphthalmia, like complex wherein you have some microorbitism or conditions like that. And according to Gopal Krishna classification, we know that grade 1 is where the inferior fornix is shallow, and grade 2 is where the inferior and the superior fornix is shallow. So in our study, we have included cases up to grade 2 contracted sockets. So when it comes to management of microphthalmia, it is actually age dependent. When a pediatric age patient comes, we always say that earlier, start the expansion at the earliest. But whatever is the age group, it's usually a good teamwork is needed between the ophthalmologist, ocularist, and a very supportive family. So aim of treating any microphthalmic socket is to rehabilitate the socket in order to allow the retention of a suitable prosthesis and to develop an acceptable and symmetric appearance. So when an adult patient with microphthalmia comes to you with a treatment naive socket, so usually they have never taken a treatment till now, they are mostly not very willing for surgical intervention. That's when we thought, why not try the serial conformer expansion in adults. So I'll be presenting this case series where desirable socket expansion was achieved with conformer trial alone in adult patients with simple microphthalmia. We have included patients with more than 18 years with microphthalmia with a treatment naive socket up to grade 2 traction. So we know that serial conformer expansion is where you start expanding the socket with most snugly fitting conformer, and slowly over a period of 4 to 6 weeks you increase the size of the conformer till a desirable expansion is achieved. So this is one example of a patient who was 22-year-old. You can see that she has a right microphthalmic socket. We started expanding her socket with an 18 millimeter conformer, and she was followed up at every 4 weeks, and at 24 after 4 months, where we could place a 24 millimeter conformer, we were able to dispense a customized ocular prosthesis for her. So this is her final appearance. So we know that prevalence of anophthalmia and microphthalmia is around 0.2 to 3 per 10,000 births, and literature says early expansion is always recommended. So the basic principle is mechanical stretch stimulus for the tissue growth. So when an adult patient comes to you with some volume or surface loss, what we usually think about is either replacing with the volume with an implant, and then augment the surface with either MMG or EMG, and or else something like a dermis fat graft. So but there are observations that microphthalmic eyes have an potential for growth if the axial length is more than 16 millimeters. So in our study, we have included around 7 patients, and the mean age was like 26 point. It's not moving. Slide is not moving. So mean age was 26.28, and the least width was 15 millimeters, and the mean duration for expansion was 4.7 months. So this is the second case. She was again in her late 20s, and this is at the end of 6 months. So again a patient, he was the oldest patient in our series with 34 years, and at the end of 5 months, this was the result. So in conclusion, we can achieve good socket expansion with conformers alone in adults with simple microphthalmia, not associated with any microorbitism or other microphthalmic syndromes. But yeah, limitation is that we have to still follow up, long-term follow-up is still needed to know the further outcomes. Thank you.
Thank you, Dr. Saab. I think we all agree that contracted socket is the most difficult cases in oculoplastics. We all know, and it's a very good series presented by you. Anything?
Yes. I would like to ask how you have 100% success rate?
Yeah, in all these 7 patients, yes, we have had. But we have chosen only up to grade 2 contracted sockets, and most of them did not have any other, facial hypoplasia or mid-facial symptoms, nothing.
There should be, I think, some time you have to wait. Then after that, if doesn't work, maybe you have to
so
go for.
only in one patient we had to modify the conformer a little bit, like customize the conformer. Others, we were using just the stock conformers.
No, I'm
Only-
not asking that. Suppose you are waiting for a period, then
Yeah.
it doesn't work.
2 4 weeks, like
Huh.
first follow-up.
Hmm.
Every follow-up is at 4 weeks. So at the first follow, like after 4 weeks, there's no much expansion. We have tried for one more, like 4 weeks, and if not, yeah.
Go for surgery,
Yeah.
I think. Okay, thank you.
She has purposely taken the grade up to grade 2 only. Okay, thank you.